Hi, it's Dr. Smith from Wigston Central Surgery. We wanted to make another video to help us work well together to provide the best care that we can for you. In today's video we wanted to talk about blood pressure. Having high blood pressure can be quite a difficult medical problem because often you can feel completely fine and have no symptoms at all, and so it's difficult to realise that there's a problem there at all. But if you have high blood pressure for a long period of time, it puts a lot of strain on your blood vessels and makes it more likely that in the future you might have a serious medical problem like a heart attack or a stroke. So we've got a few ideas of how we can work well together to monitor your blood pressure and reduce the risk of you having these problems. So how often should we be keeping an eye on your blood pressure? Well, if you have a known blood pressure problem that needs medication, or if you have another medical condition that might increase your risk of heart problems or stroke, such as diabetes, or if you've had a previous heart attack, then we will need to get a blood pressure from you at least every year, and possibly more often than that. But if you're generally fit and well, and don't take lots of medication, and don't have any of those health conditions, then we would be saying we definitely need a blood pressure from you at least every 5 years. It's really important that we keep a close eye on your blood pressure in order to pick up any problems that might be there. As I mentioned before, you might not be aware of those problems before we identify them. So if we identify that you have a high blood pressure, what might we want to do about it? Well, we know that having a one-off high reading in the practice is not necessarily the most accurate way for you to monitor your blood pressure. So there's different things you might want to do. You may want to actually buy one of these blood pressure monitors for yourself, and we'd really encourage you to do that if you do have a problem like diabetes or a heart problem where we know we're going to be keeping an eye on your blood pressure quite closely. These probably cost about £20 or £30. You can get them from your local pharmacy or online, and usually they're pretty well calibrated so we know that they're accurate. And once you've got your monitor, we'd like you to do a week's worth of home blood pressure readings using this form. What we'd like you to do is to do 3 readings in the morning and 3 readings in the afternoon, and take those for an entire week. We'll work out the averages and do the rest, and if there's a blood pressure problem, we'll make sure you know about it. But we realise that not everyone will be in a position to be able to buy one of these. So we've got a new rental service available for you where you can come to our desk and you can rent one of these monitors for a week in order to do a week's worth of home readings for us. What we'd ask is, if you come in, pick up the monitor and give us £20, and then once you've done a week's worth of readings, you bring them back, pass the monitor back to us, and we'll give you your money back. We hope that this will be a helpful scheme for people, so they don't have to buy a monitor for themselves, but we're still able to provide them with the care that they need. It might be that we want you to do a one-off blood pressure reading just to keep an eye on things, and most local pharmacies have signed up to a scheme where they'll be able to check your blood pressure for you and then let us know the results. So that'll be a really helpful way for you to get your blood pressure done. If we get in touch with you and say, we'd like a blood pressure check, those are the different ways that you might be able to get it sorted. At the pharmacy, coming into the practice to use our monitor, or doing some home blood pressure readings with your own monitor, or renting one from us. So if we identify you've got a high blood pressure problem, then you might need to go on medication. But there's other things that you can do that will be helpful for you with your blood pressure. Reducing salt in your diet would be greatly beneficial, and if you're overweight, then trying to lose some weight would be helpful too, although we know that this can be really difficult. Also, following general healthy lifestyle advice such as not smoking, only drinking alcohol in moderation, and exercising regularly will all help you with your blood pressure. Now, we know not everyone will be able to do all of these, but it's important that you do what you can to help your blood pressure, to reduce the risk of you having these problems further down the line. So I hope that's been a helpful summary on the topic of blood pressure and blood pressure monitoring. We'll see you soon.